Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Phil Dickinson, who is the CEO of the National Council of State Boards of Nursing, about the new 2024 NCSBN workforce study and its implications on the industry. So, hi, Phil, how are you?
I'm doing very well, and you?
I'm doing well. Thank you for asking. It's Friday when we're recording this, so that's fun.
That's good. Always good.
Absolutely. So, we're here to talk about workforce today, which obviously in nursing is always the biggest deal as we experience, nursing shortages and workforce shortages across healthcare in general. So, I wanted to get into this study a little bit. Right off the top, what was the goal of the 2024 workforce study? I was hearing that this has been an ongoing study since 2013. So, tell me a little bit more.
Yeah, I think it isn't the goal of the 2024. It's the goal of what I call the research inquiry. Think
Mhm.
about this. We started this in 2013, and it's probably one of the largest, at least sample sizes and comprehensive look at the workforce. And the idea is that we can see trends as they develop, as well as know what the current state of the workforce is every 2 years. And quite frankly, I think the 2024 has been a great year because it also showed us some great promise in that the trends are looking good in certain areas, but it also pointed out some areas of caution that we should be looking at.
hmm Absolutely. So for our listeners, can you give me a brief overview of some of the key points from the results?
I think probably one of the most positive results is we've started to see a rebound in the size or the number of individuals in the workforce. We've started to see that sort of start to grow in the right direction.
Mhm.
We've seen also, I think it's particularly important, although maybe it will look sometimes, we actually saw the median age of our nurse workforce go up,
Hmm.
and one of the reasons we saw is that we noticed that there were nurses who had left the workforce had come back in, experienced nurses. So I think that's a
Mhm.
great sign. We saw some advances in how many BSNs were in the survey, bachelor's degree RNs. All right,
Mhm.
we saw that grow as well. It's the largest it's ever been. And so I think those are really, really positive signs. All right. Now, the caution indices for me though are that look, even in that particular sample, uh, we had lost about 138,000 nurses. All right.
Mhm.
Um, and that while some of the issues through the years have always been present, such as stress, burnout, those sort of things, we saw them moderate a bit.
Mhm.
However, I think that is a cautionary tale in that they still exist. They still seem to be moderately high. And that means to me, we have to be concerned, is the growth we're seeing in the numbers of nurses sustainable? In other words, is that
Mhm.
workforce trend going to be sustainable?
Mhm.
Particularly, the other part of the study is that about somewhere around 40% of that particular sample indicated their intent to leave the profession in the next 5 years. So, really good stuff, but some cautionary tales here too.
Absolutely. And I wanted to ask you about that 40%. I think it was they're intending to leave the workforce by 2029.
Yes.
So, what are some steps that you think CNOs and other healthcare executives can take to kind of prepare for that and to maybe try to prevent it?
Wow. Here's the thing I think we all need to remember is this is a multifaceted problem. And so CNOs on their own, I don't think are the only solution set. And what I would argue at this point is somewhat of a call to action uh, within CSBN and all of our partners,
Hmm.
our clinical partners, our practice partners, our education partners, and our policy partners, because I think this is not a single solution set. Now, we know we've got some moderation going on in these areas. I mean, the survey certainly indicated that. And we know that certain healthcare systems have done a pretty good job in adding some mental health programs and education to the nurse force. And we know that they've added some of the de escalation training. Um,
Mhm.
but we've got to expand on that because clearly moderation is one thing, but we're not making it go down either. So we've got to look
Mhm.
for different solutions here.
Mhm.
So I think you're asking me for a solution. I don't know. I mean, you can go back through the literature and find out the things that we've done already. Stress reduction, those sort of things. But I think we're going
Mhm.
to have to think outside that box to get it lower.
Absolutely. And I want to kind of piggyback off of that. There were five main reasons cited
Yeah.
in the study for why nurses are leaving the workforce. And
Hmm.
for our listeners, that was stress and burnout,
Hmm.
workload, understaffing, inadequate salary, and of course, workplace violence,
Yeah.
which I don't think is surprising to anybody.
Right.
So, what are your thoughts on some of those strategies that CNOs can use to address these issues, or at the very least, try to lower them? I know there's no
Okay.
magic bullet, but what are
Yeah.
your thoughts?
Well, obviously, I think that we've got to. I don't want our survey, for instance, 800,000, and we're throwing out numbers. I've just done it to you, right? But I
Mhm,
want us to actually start thinking differently. Every one of those numbers is a voice. It is not
mhm.
simply a number on a page, all right?
Absolutely, yeah.
And my argument is we need to be better about, as leaders, listening um, before we act, listening
Mhm,
to these voices of the nurses before we invoke solutions, bring them to the tables so that we can hear that. Obviously, I think we've got to work on um, certainly staffing ratios, right? And
mhm,
maybe our growth in the workforce numbers are going to help with that, but we have to get them in the right places, right? Because
mhm,
we're giving you broad numbers here. I don't know if the stress is more related to somebody in an ICU versus a NICU versus a med ward, right? We don't know
mhm,
these things. We need to find those out because maybe, we're doing correlations now, but maybe there's better correlations that stress is higher in those areas. I mean,
mhm,
intuitively, one of us, we might believe that, all right? But is it true? And if it is true, then what are the causes of stress in that area? By the
mhm,
way, we also have to realize as an industry that the nursing profession, once you decide to go in it, whatever passion you have, is always going to be stressful. It is by design stressful, right? Because
mhm,
we have to deal with patients who are uh, they're in pain, they can't breathe, they're dying, right? and
Absolutely, it's a hard
and
job, yeah,
it is a
for
hard job
sure.
any way you cut it. And so I think
Mhm,
one of the things our nurse leaders could do is work with our educators to better prepare the passion of that nurse as a student to the environment that they're going to walk into, so that they're
mhm,
not shocked on day one as much as they might be, right? I think that that would help. I think that using experienced nurses who have dealt with 10, 15, 20 years of nursing and the stresses that have always been there, to listen to them, how they cope, and help the younger nurses develop some of those coping mechanisms is important. It won't make it all go away. I admit that. I think that
mhm,
these are, we talk about stackable credentials in education. These are stackable strategies in what I call the practice setting.
mhm, mhm. Absolutely. And you had a really good quote about not using COVID-19 anymore as an
Yeah.
excuse to
Yeah.
why nurses are leaving the workforce. So, can you unpack that quote a little bit for me
Yeah.
and share your thoughts more on that?
I think the problem with using the COVID experience, right,
Hmm.
is that was a unique experience, right?
Hmm.
No one predicted the impact of that, the depth and breadth of that, right?
Yeah,
But
absolutely.
we, if we only look to COVID for solutions, we're looking at, from a scientific standpoint, for me, an outlier, right? Because as I've said already, these problems, not the shortage, but these problems around Stress, burnout, wages, all of that, those
Mhm.
existed before COVID.
Absolutely. Yeah.
And so trying to only focus on COVID is really what I would call blinders or a narrow vision. And I don't think you find the solutions from that.
Mhm. Absolutely, yeah, and like you're saying, all of those issues existed before, and they continue to exist now. And
Yeah.
COVID might have exacerbated
Right.
several of
Absolutely.
them, but it's definitely not a cause.
That's right. It's not a cause. I guess I like how you put it. So I wish I'd have said that. But it's
No
it
worries.
was not the cause, right? We have to if we
Mhm.
blame it, it becomes the cause and we miss the solutions, I think. All right.
Yeah, absolutely. Yeah, and it's pointing to more. I feel like it was COVID was like a mirror to the healthcare system in many ways.
That's a
Um,
great statement too, because I will argue that what COVID did was highlight and exacerbate issues that already existed.
mhm,
And
exactly.
and we need to go, we're in medicine. We know you can treat symptoms all you want, but if you want to make a change, you treat the root cause.
Mhm, mhm. Absolutely. So, in terms of the continued work that NCSBN is doing with this study, what does the future of the workforce study look like? I was also told that you might be starting on the 2025 study already, which is great.
Wow. Yeah. Well, we're always, it's a cycle, so we are obviously always starting on that. But look, you've got 800,000 data individuals with
Hmm.
each giving a plethora of data points, right? So
Yeah.
the other thing that we need to do is ask what I call post hoc questions of the data and see if we can find answers to our solution questions or at least directions, because I think that we've got to be able to have a, a finer look at the distributions of certain things in this study, if possible. Remember, it was a national study, not a state by state study.
Hmm.
So, could we look deeper at the data and bring the right be the catalyst as the council out of this survey to bring the individuals to the table to seek solutions,
Hmm.
lasting solutions.
Absolutely. So then my last question for you is what are some key takeaways that you want CNOs and nurse leaders specifically to take away from this data?
Oh, from this data,
Yeah.
I think, yeah. Like one is, uh, I have this fear, and I hope I'm wrong. I have this fear that because we're showing moderated stress and burnout
Mhm.
data, that it will somehow become a back burner issue. All right.
Mm, mhm. Yeah.
And my argument, and probably why I keep harping even on there, is let's not let that happen.
Mhm.
Because just the fact that we moderated, yay, that is a good thing, but it is not solved.
Mhm.
And I would argue nurse leaders need to prioritize these um, these moderated elements: stress, burnout, salary, workplace violence. We need to prioritize that as a moment in time now to go forward and
Mhm.
seek and not just talk about solutions, seek and implement solutions.
Mhm. Absolutely. Well, I hope that those takeaways can be put into practice. And I speak to a lot of CNOs in this job, and I can tell you personally that many of them, they all are advocating for these things, and they see these issues, and it really matters. To them, so hopefully the NCSBN can continue their work, and we can move forward as an industry.
Absolutely. And I think that's
Is
it.
the goal.
The concept of one NCS fan is all of us, and that
Mhm.
means all of our partners as well. So, yes, I want to do that.
Absolutely. Well, thank you so much, Phil, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening. Thank you.
Thank you so much.